I heard a internal discussion within a healthcare industry. There was one of the counties here where I live is Grey Bruce, and they brought together a number of their physicians, ER workers, anybody who was within the healthcare industry, and they had this sort of closed door Zoom meeting for the county where they were expressing some of the new ideas around vaccine mandates, what was to happen, what you need to do. Here's some of the new data, et cetera. And one of the healthcare workers, she was an ER practitioner, she secretly recorded the entire thing. And listening to it was interesting, not so much because of the controversy that took place, but also hearing the way they were going about the conversations behind closed doors between just physicians and not the public. And what I found interesting about it was the idea that, even these physicians were talking about how, public policy right now, they're not even bothering to offer nuance whatsoever to the public. They're not even trying. They're not even making an effort, because their goal right now is, and perhaps this suggests some of their bias, but the physician was essentially saying, this pandemic is so bad, it's so problematic that we have to just do what is going to affect the lowest common denominator, the easiest, which is just here's what we're doing. We're not going to bother to talk about it. We're not going to offer nuance. This is what's happening, period.
Dr. Killian, I would say probably in a pandemic, some of those pieces that you think would be there when you have lots of time to review stuff and that kind of stuff, over time for research, et cetera, and running this all out, it's quite normal to have it if you have lots of time. But in a pandemic, they're going to pass mandates, and they're going to pass laws, and they're going to pass directives as needed to manage that pandemic. And some of those things that they do will feel like they're infringing on or taking shortcuts or taking, a quicker move left or right. They're doing that directly to save lives. And they're probably communicating in a way that makes it as simple as absolutely possible. They're probably not thinking about how they might communicate with an infection control specialist or an emerge doc or a lawyer. They're thinking, this is the directive we have to make. It has to be at a grade 5 level. It has to be very straightforward for people to understand. And that's how they put them out.
And so the trouble with that culture is we are playing to the lowest common denominator. So, it's not to say that some people are more, we're not trying to say who's smarter than who. We're just trying to come to the realization that there's many of us in society who like to critically think, who like to look deeper, who like to, understand nuance. And when we don't get that whatsoever from the mainstream media, mainstream culture, government policy, government discussion, we think there's a massive issue going on. So we start to look into it, and I think this is another one of the key issues, is that the general public seems to be making significantly better points, arguments, bringing different ideas to the table than the government. And unless the government starts to acknowledge that what they're offering is garbage, to be quite honest, we're not going to get anywhere, because it's now just turning citizens amongst one another. So there's a big cultural change here that I think has to occur, where politicians have to stop playing stupid, and we have to start speaking more honestly, more intelligently, more transparently, including larger discussions. I don't think playing dumb is leading us anywhere.
Very well said, Joe. And to your point, I mean, in the US in particular, what does that do, right? It creates massive mistrust in these institutions when people know that they're not being honest, they're not being forthcoming, and they're leaving no room for nuance. I mean, this is typified by the natural immunity discussion, where for months, years now, it's been 18 months that the public health establishment in the United States has said, oh, natural immunity, we don't think it's very robust. It's not significant enough, to where their blanket statement has been, just get vaccinated, just get vaccinated, just get vaccinated. There's nothing else you can do. There's nothing else that matters here other than your vaccine status, which now even Dr. Anthony Fauci now is backtracking and saying, well, maybe we should actually study natural immunity and look at it again, as if, which again, is just going to lose people at exponential rates to where they have no trust in our institutions.
Yes, I want to add to this. This is a really good point, because it's bringing us full circle back to natural immunity, where we agree upon. And what you've just brought up here, both of you, is about trust with our authorities, ignoring basic tenets of immunology with natural immunity. Let us for a moment, venture off into the idea that what I was presenting before was the fact that the vaccinations are causing the variants. Okay, I understand that we don't necessarily agree upon that. But if we find that to be true, what is going to stop new variants from emerging from new boosters? Because we're making very specific vaccines, and the variants keep emerging, and then we boost other people. What is going to stop the cycle? The only thing that is going to stop it is broad natural immunity in a large sector of the population that can become infected, fight it off, and then remain immune to any other variants. So as we twiddle our thumbs here and saying, well, we don't know, and Fauci says this, and we can agree to disagree, and we still start having attrition with the unvaccinated swath of the population, we could be thinning out our buffer to something that could actually stop this pandemic. That might be the answer. So it's not merely a matter of let's tell the right story and be honest. We could be really jeopardizing any possibility of emerging from this pandemic if we keep vaccinating people. That's a huge epidemiological question that has to be answered.